Welcome to another episode of Optimal Anesthesia, where we delve into the fascinating world of perioperative care. Today, we're exploring a topic that's crucial for anesthesiologists alike: perioperative neurocognitive disorder, or PND. PND is a comprehensive term that includes behavior, mood, and cognition changes. It encompasses several conditions, including preexisting cognitive impairment, postoperative delirium, delayed neurocognitive recovery, and persistent postoperative neurocognitive decline. Let's start with preexisting cognitive impairment, common in individuals aged 65 and above. These patients are at a higher risk of developing postoperative delirium, enduring cognitive impairment, or even dementia in the future. Postoperative delirium can manifest in two forms. Emergence delirium occurs shortly after waking from anesthesia and is characterized by restlessness, confusion, or excessive drowsiness. Persistent or recurrent delirium can occur later in the postoperative period and requires prompt evaluation and intervention. Postoperative neurocognitive impairment refers to subtle changes in cognition and daily functioning. It can manifest as delayed neurocognitive recovery, lasting up to 30 days, or as a more persistent disorder lasting over a year. The pathophysiology of PND is complex, involving factors such as preexisting cognitive vulnerability, perioperative stress, inflammation, anesthesia effects, and more. These factors can contribute to cognitive decline and impair brain function. Anesthesia plays a significant role in PND. Factors like depth of anesthesia, blood pressure management, and choice of anesthetic agents can impact the risk of PND. Anesthesiologists must tailor their techniques to minimize this risk. Postoperative prevention and management strategies are essential. Non-pharmacologic measures like cognitive stimulation and early mobilization can help reduce the incidence of delirium. Screening tools and postoperative care guidelines are crucial in identifying and managing PND. PND is a multifaceted condition involving a combination of factors that contribute to cognitive impairment following surgery and anesthesia. Let's explore these factors in simpler terms. First, pre-existing cognitive vulnerability plays a crucial role. Individuals with existing cognitive issues or those at risk due to age or genetics are more susceptible to PND. Their reduced cognitive reserve makes them prone to deficits after surgical stress. The surgical process itself introduces stress and inflammation, triggering a release of stress hormones and inflammatory molecules. These can impact brain function and contribute to cognitive impairment. Anesthesia also has complex effects on the brain. While it induces a controlled state of unconsciousness, certain agents can interfere with neurotransmitter systems, disrupting neuronal communication and contributing to cognitive dysfunction. Changes in cerebral blood flow and oxygen delivery during surgery and anesthesia can lead to temporary reductions in oxygen levels, impairing brain function and contributing to cognitive decline. The blood-brain barrier, which normally protects the brain from harmful substances in the blood, can be compromised by the stress and inflammation of surgery and anesthesia. This can allow inflammatory molecules to enter the brain, potentially causing damage. Some anesthetic agents and medications used during surgery have been linked to neurotoxic effects, especially in vulnerable populations like the elderly, contributing to cognitive dysfunction. Postoperative complications, such as infections or organ dysfunction, can further stress the body and increase the risk of cognitive impairment. Additionally, surgical procedures can lead to microvascular damage, affecting blood supply to different brain regions and contributing to cognitive deficits.
Now we'll explore how careful management during surgery and anesthesia can help prevent postoperative cognitive issues like delirium. First up, let's talk about the depth of anesthesia. Going too deep might increase the risk of postoperative delirium, but it's not clear if it's the direct cause. It's important to adjust the anesthesia dose based on age and individual factors to avoid this. Continuous monitoring is key. We use end-tidal anesthetic concentration (ETAC) to adjust inhalation anesthetics and maintain the right level for each patient. Monitoring brain activity with EEG helps, especially in older or high-risk patients. When it comes to regional anesthesia, it's best to avoid excessive sedation, especially in older patients. While the data is still evolving, it's wise to err on the side of caution. Blood pressure management is crucial. Keeping it within 20% of the baseline with a mean arterial pressure (MAP) of at least 65 mm of mercury helps maintain brain oxygen levels and reduce the risk of postoperative cognitive issues. The choice of anesthetic techniques and agents matters too. While there's no definitive technique to prevent postoperative neurocognitive disorders, some studies suggest that neuraxial or regional techniques may help in certain cases. Finally, medication considerations are important. Avoiding high doses of certain anesthetic agents and medications, especially benzodiazepines, can lower the risk of postoperative delirium. In conclusion, understanding PND is vital for optimizing patient outcomes. By implementing appropriate strategies, healthcare providers can reduce the risk of cognitive decline and improve the postoperative experience for patients. Thank you for joining Optimal Anesthesia today. Stay tuned for more enlightening discussions on perioperative topics.